So, good afternoon, everyone. My name's Hope. I'm a research assistant on the Born in Wales project, and today I'm here with Ashra and Solmaz, who are part of our PPI involvement group, and we're just going to answer a few questions for you.
Okay, thank you, Hope. So I've got a question for you. What did you learn about community engagement through your involvement in the Born in Wales research project?
I think working on this project this past year, it's been quite an unusual time. So during COVID, it's been quite difficult to engage with people, I think because of the lack of face-to-face interactions and actually meeting in person, that changes your engagement with people and how you interact. But I have learned that there are various groups that we can be involved with, such as the Race Council Cymru and ACE, that we could contact about engaging with ethnic minority groups, which is really helpful to know. But I think it's important to have a continuous conversation with different communities to make sure that you're answering the right questions. They're guiding you on what to ask, how to engage, and have a two-way conversation and keep having that relationship as you're moving forward, building relationships with different groups. And I don't think that happens really quickly. I think it'll keep on growing as the project progresses. So
yeah, I definitely agree with that. You know, building that link does take time, and yeah, I think research projects need to allocate the time and resources in the project plan and budget to do this work, so that you can go and tell groups why you're doing this research and why and how this research can help them and why there's a problem with the issue that you're looking at and how they can make a difference. So, for example, in Born in Wales study, I suppose people may not see the relevance of the study because they might think, you know, babies are born every day. They don't see any problems occurring with births of people that they know of. So, yeah, it's a challenge, I think, getting into the communities.
So I have a question for both of you. So why did you get involved in research?
I think my involvement is about because I'm from the minority group, so I think that I can pass my voice from my community to the PPI panel.
So I got involved in research because I wanted to understand some of the problems that affected people sort of in different communities, and also I'm an ethnic minority myself as well. So I wanted to see how research can improve people's health experience of healthcare and access in healthcare and the overall outcomes for them.
So what advice can you give for how we can engage better with communities?
I think it is about doing that early engagement work, going out to people, presenting your research, and then also linking with gatekeepers within the community. And that doesn't need to be formal gatekeepers. It can be support workers, not just like, say, for example, if you're working with the Race Equality Council, it's actually the support workers who have that day-to-day contact with people, and building, you know, going out with them to see people, visit people, go to events organised by the third sector organisations and get in contact with people that way.
Yes, exactly. If we could just meet people in their community, and if we could have each member from like each community, from poor area, rich area, Black or Asian, anyone, if we can have one representative from each group, it can be really helpful in clinical research.
That's great. And we look forward to having more conversations and working together in the future on this project. So thank you.
Thank you.
Thank you.
Thanks.